PCOS is an ovarian dysfunction condition recognized by the presence of a number of symptoms that are seen together, and these include reproductive symptoms, hyperandrogenic or skin symptoms, and metabolic symptoms. So women usually have problems with ovulation and fertility, or skin problems due to high levels of male hormones, or some metabolic problems due to insulin issues such as weight gain and other eating problems. Symptoms include menstrual irregularities, usually infrequent or absent periods, which will lead to subfertility issues, difficulty to conceive. Other symptoms include skin symptoms such as excess hair growth, especially on the face, or acne or baldness. And the last type of symptoms are the metabolic symptoms, which include weight gain and difficulty to control and lose their weight. There have been historically several schools of diagnosis, but the latest update on this is we use what we call the Rotterdam criteria of diagnosis, when you have a combination of 2 out of 3 features of the conditions. And these include, number 1, menstrual irregularities and lack of ovulation. Number 2, ultrasound presence of polycystic ovaries. When you look at the ovaries, they look polycystic, i.e. they have multiple little cysts. And lastly, excess androgen or male hormone production, either clinically on the skin or in the lab when we measure the blood levels. There are 2 major strategies for treatment of PCOS. Firstly, to improve the overall general health of the woman. And this is by improving insulin metabolism, because most of them have insulin resistance. So the lifestyle measures, dieting and physical activity and exercise, or insulin sensitizing agent such as metformin or inofolic acid, as we mentioned earlier. These medications need to be prescribed under supervision of the healthcare providers. And the second line of treatment is we address the concerning or the main symptom the woman is presenting with. So if she comes with fertility issues, we induce ovulation to help her to conceive. If she comes with skin problems, we give them certain medications to help improve their skin problems, and so on and so forth. I think the first thing is to have an insight into this condition, to be informed, well informed of the conditions, to work on their lifestyle. And I have to say, this can be a challenging issue with women with PCOS. They usually find it extremely difficult to get their weight down, but remaining positive and trying to stick to the healthy, low-calorie diet and regular exercise is extremely helpful for their PCOS and general health, and the long-term risks of diabetes and blood pressure problems and heart problems.